me know, okay? But I think it looks good. I can tell because I can see where it looks choppy. So let's do another question here. This question came from Andrea, and Andrea said, "My little boy is just over 3 weeks, and I pump in between feedings while I can. At night, he goes through cluster feedings and usually consumes all the extra milk that is pumped throughout the day. I'm looking to return to work, and I don't know how to build up more of a supply. Any advice or suggestions would be greatly appreciated." Okay, so what she's saying is that she has a 3-week-old, and she's pumping in between feedings while she can to build up milk for when she goes back to work. Let's just start with that, because sometimes, you guys, the question that you're asking is not actually the question you should be asking, although you don't know that you shouldn't be asking it. So I'm going to go really to the more of the concern here, more than what she's actually asking, which is she's trying to figure out how to get more milk in between her feeding sessions for a 3-week-old so she can go back to work. The point here is that she's probably not going to get a lot more milk than what she's feeding, because her body's making what she needs to feed her baby right now. And it's very hard to pump a lot of extra milk for storing for when you go back to work. If it's that early on, if you're going to try to store to go back to work, then you want to do just a little bit at a time. All right. And that means that maybe about an hour, it's still choppy. You can still see it. I still see it's choppy. Are you guys able to hear me? I have to call it quit.
No.
Oh, Joe saying no, don't quit yet. Can I know it might help me off if I switch.
Really fast.
All right, we're gonna try something here. I'm gonna go back on Wi-Fi. Okay, I think I'm good. Thank you. I think it's good. Okay. A few people, committed people, diehard, my people stuck with me here. All right, it's too choppy. Okay,
You went to
connected.
There you go.
All right, are we good? I'm like afraid to get excited here that it might actually work.
Get excited. Is it building you already?
Talking and nobody can hear me. I said so many great things and you missed all of it. I think it's all over. Joking. Okay. All right, choppy. All right, let me hear how it is now, because we might have to just forget about it tonight. I don't know, until we get this fixed or something. I'm not sure what happened. It looks good now, but then it teases me, and then I think it's okay, and it's not okay. This is not wine, but I'm going to pretend it is right now.
I'm going on Amazon right now.
It's not wine. I think I need some wine. That's the problem. Maybe I needed a glass of wine. Maybe the internet needed some wine tonight.
The router drank it.
Mm-hmm. I think the router drank it. Look, keep listening. Okay. All right. All right. All right. So far, you dare. Okay. No sudden movements. You're right. I'm afraid to like shake anything here because it seems like it's working and then it's not. Okay. So let's keep going here. Okay. So where was I? Andrea. Andrea was asking about pumping for her 3-week-old in between her feeding sessions, and if she wants to store up some milk, you know, it's really important that she starts calculating exactly how much she needs for her first day back. Because if she's trying to pump a whole bunch of extra milk for a 3-week-old, that's not going to work. It's just not going to work. It's not good for her. She really needs to try to get in sync with her baby. She's only 3 weeks old. So when she says, I need to return to work soon, I don't know how to build up more of a supply, the only thing she needs to do is think about how many hours a day she's going to be leaving her baby, calculate how many ounces she's going to need for her first day back, and then I feel like one of those movies where my mouth is moving and then when she's pumping, she only needs to pump enough for that first day back, because on the first day back to work, she'll need to leave milk for the baby. She'll be pumping at work for the next day. So you don't need a ton of milk for your first day back. You just need enough for what your baby's going to eat. And that might be, you know, depending on how many hours you're leaving, how many feedings, maybe 9 ounces, maybe 12 ounces, depending on how many feedings. That just means that you need to pump 1 ounce per day for 9 days leading up to your first day back. That will be enough to leave milk for your baby in order to go back to work, okay? Sit still. Yes, I'm trying to sit still, but I'm very upset that with this internet, it's driving me nuts. Okay, so, yeah, Andrea, let's give her some hearts. Maybe we need some love. I think that's what we need, is some love across the screen. I know I need it right now, because can you tell I'm super frustrated? Super frustrated. Let's get some hearts. Hearts for Andrea, hearts for Shari, so that she can relax here and not be angry at the internet. Gratitude. Gratitude. It is Thanksgiving. Giving thanks. The fact that we can even do this, it may not be perfect, but that's okay. That's okay. Okay, good. All right, so we're going to keep on going because it seems like it's working and you guys have stuck with me. So why would I give up on you? I'm not going to. Okay, let's do another question here. This one came from Lauren, and Lauren said, we are hoping to be moving across country. That will be 2.5 to 3 hour day drive. 2.5 to a 3 day drive. Okay, I was going to say, boy, you drive fast cross country. That'll be a 2.5 to a 3 day drive across country. She has a pretty hefty freezer stash. So what advice do I have on making sure the milk makes the trip? Okay, super important because you don't want to lose that stash in those 2.5 to 3 days. One way that you can do that is to, you know, obviously pack everything in ice, but you're going to have to replenish that ice and replace that ice so that it stays, your milk stays frozen. You need to make sure that you're getting new ice and filling the cooler, whatever you're using to move it with. A big cooler would be preferable. Another thought I had in reading your question was dry ice. Kate? Okay, so yes, Kate, dry ice. That's what I was going to say, Kate. So you crack me up. You do. You crack me up. I'm laughing here. Okay, so dry ice would be probably my best recommendation. That's going to last a lot longer. It's going to keep it really ice cold. You won't have to replenish it the same way. So what I would do is look up the instructions for packing in dry ice. The same way as if you were going to ship the milk is how I would pack it up to bring with you in dry ice, okay? Good question. Good question. Good luck on your move. And hearts for Lauren. Let's give hearts for Lauren so that we can say thank you for that wonderful question. Hearts for Lauren. All right. Hearts for Lauren. Hi, Lenka. You're late, but you didn't miss much. Believe me. Just me being very angry at the internet, Lenka. So you'd be happy you were late. Oh, there's Lauren. She's on here. Good luck with your move, sweetheart. Yeah, dry ice will be the best thing. See, look, we're giving hearts to Lauren, and Lauren's right here with us. How wonderful is that? Excellent. Okay. Let's keep going. Looks like things are taking off a little bit here and doing way better. Question from Deneen. Hi, Deneen. Okay. What would cause a sudden drop in supply? I am not doing anything differently, and I have been for the last. Okay, hold on. I am not doing anything differently, and I have been for the last week and a half. I've been pumping 10 ounces less than usual. It happened overnight, and I can't seem to bump it back up. I've tried adding extra sessions and even power pumping sessions. I still make enough to feed my baby, but maybe 3 to 4 ounces extra a day. That is it. My little one is almost 10 months old. I exclusively pump. So, Deneen, I know that you're pumping to feed your baby, and also you're donating. And so that 3 to 4 ounces extra per day may be less than what you were making, but it's not as much as you want to make. And it's still good. You're still making enough to feed your baby with extra. What would cause you to decrease the amount you're pumping? It could be several things. The thing that comes to mind is it could be the baby's 10 months old. It could be that hormonally, you may be getting your period back again. You may be just going through a hormonal change that is very normal, where the supply starts to decrease as your baby is starting to increase solid foods. As you know, even though you're exclusively pumping, your body may be producing less and less. The other thing too is that it could be that, I know that you work a lot and you're at work pumping, and it could be that a little bit of extra stress at work could create that as well, although not usually as much as a hormonal impact. The other thing that, if you're not taking care of yourself, if you're not eating as regularly, if you're not drinking as much, I kind of want to know how you did this past week, if anything changed. You said that you weren't doing anything differently, but I'm thinking that you mean that as far as your pumping routine. If you're doing something differently with yourself, that could have an impact on your supply. 10 ounces is quite a bit, so my guess is that you may be getting your period, and that would definitely have an impact. All right, see how it goes. Try to like you said, power pump, adding the extra pumping sessions, doing one extra at night might really help that. So try doing a extra feeding during the middle of the night versus just more during the day, which will make it easier on you too if you're back at work. All right. Yeah, that's probably what, and if it is from that, then what you'll notice is that after your period's over, it should increase back up again as long as you're pumping and expressing as much. Or it just may be that you're finding a new normal. You're finding a new normal, which is still adequate for your baby. It's just that your body's not doing the extra, which if it's not, you did amazing, Deneen. And if you can't do any more than this, it's still perfectly fine. Okay. Yes, you're talking about magnesium supplement helps with the supply dip with your period too. Yes, that can help. And it actually leads into another question here, which had to do with fenugreek, galactagogues, things that help to boost supply. And you need to be very careful with some of these things. You don't necessarily, some of them will work great, and some of them can have some side effects, which this came from Melissa, who was actually, first of all, hearts for Deneen, and hopefully will increase your supply, Deneen. Hearts for Deneen, okay, because I know that she's worried about this. Melissa asked the question, my little one will be 6 weeks old on Monday. I was making 42 to 58 ounces a day while taking the supplement pictured. And she sent me this picture of something called Milk Flow, and it has blessed thistle in it and fenugreek. Okay, so that's the two main ingredients. She was making 42 to 58 ounces a day while she was taking this. After 3 days of taking it, she started getting massive headaches and she stopped. After stopping, her headaches went away. What could be the cause of that? Something in the supplement itself or dehydration? I do drink a ton of water and such, but this supplement really helped my supply a ton. I'd love to go back to taking it. Since stopping my supplement, my supply has dropped. Okay, so this is exactly what that's exactly what we were talking about here, is that fenugreek can cause headaches. It can cause some issues with if you're diabetic. It can have side effects that you need to be careful of. You can't just take them without considering all the other, issues that they can cause. Even though they can be safe for most people, they can have side effects. And if you're saying that this supplement started to give you massive headaches, you do not want to continue with that, okay? I would not go back to it. And my question too is, why do you need 42 to 58 ounces of milk per day? Depending on how many babies you have. I mean, do you have twins? Because that's really enough for 2 babies or more. So I'm not really sure why you need to be making that much milk. We've talked about this before, that oversupply is not always a good thing. Making more than your baby needs can cause you to feel really full, engorged. It can lead to mastitis. It can lead to plugged ducts. It can lead to fore milk, hind milk imbalances. It can lead to decreased weight loss in your baby. It could lead to gassiness. So it's not necessarily the best thing to do unless you are pumping and trying to donate, as Deneen I know does, or you have more than one baby that you need that much milk. So I'm not really sure, but I'm concerned that you're having such massive headaches with this supplement, and I would encourage you not to continue with it. Yes, Tiffany saying overactive letdown her daughter. Off and certain time. Yeah, another that's another thing. Daring me asking me. Not gonna work. Let's see. Okay. Yeah, if your baby is pulling off the breast from overactive letdown, one of the things that you can do is to let the baby sit up and do more of a laid back nursing where the baby's laying more on top, especially at the beginning of the feeding. But this is one of the things that we were just discussing, oversupply, overproduction can cause. That's one of the things that can do, and it causes a difficult latch because you're so full, and it causes the milk to just come out so forcefully that's another concern with oversupply. Let's get some hearts for Melissa, because we didn't do that. Hearts for Melissa, and hopefully her headaches will be gone. And am I still frozen? Can you see me? Such an odd stream tonight. Such an odd dream, right? We never have this issue like this, but it just seems so odd tonight. What? I did. It's off. So I have no answer for why this is happening. Hearts for Melissa, and hearts for Tiffany. Hearts for Tiffany. Should we talk about what we're giving away tonight before the night is over? Let's do that, okay? Because we're not done yet, but I want to make sure I get this in because I know you guys want to win a prize, all right? So we've got a whole bunch of great stuff, and excuse me for my open box here. We had some great stuff from Even Flow Feeding, okay? This is actually not it, but we have the wonderful breast pads from Even Flow Feeding. So we're going to be giving away a whole accessory package from Even Flow, which includes breast pads. It's going to include their milk storage bags. It's going to include this little guy that I love so much that you know. This is the milk storage bag adapter. Okay, have you guys seen this? Because I've shown you before the milk storage bag adapter. I don't think we have any, Joe. Okay, and this is how it works. All right, so here's the flange on the pump, okay? And the way this works is this, let's take this off. This little thing, so if you're pumping directly into bags, which is great for those of you who are going to be storing milk, you just take this little adapter here and you screw it right on to your flange when you're pumping, okay? Just like that, all right? And then you take this and you take one of the little Even Flow milk storage bags and you stick this inside, and it's really strong. It pinches right onto that. This is a good view of it. You can see. So when you put this on, it kind of pinches on with these little teeth, all right? And it holds it really good. And now you can pump right into the bag itself. It's strong. It's not going to lose your milk. And then when you're done pumping, you can just let it go and release it and close your little bag. Okay, so these things are great. And they do, a lot of people ask me if they are compatible with other pumps, which they are for standard neck pumps, okay, for the standard size, which is a lot of them, okay. It will fit on, so you can get these little storage bag adapters and the little bags from Even Flow Feeding. We're also going to include, let's see, what else can we get? We can include the storage containers, the milk storage containers, so a pack of milk storage containers. And how about a manual breast pump, okay? I'm going to include a manual breast pump too, because I consider that another accessory. I actually like to have a manual pump for you guys, from the beginning when you come home from the hospital with the baby. I had a mom here last week. Nipples very sore, very difficult time latching the baby. She needed to express a little bit of milk, and she did way better with her manual pump than with an electric pump right in the beginning. I just think it's one of those things that everybody should have, because some people respond better to that for expressing a little bit. It's not going to be great for like daily pumping where you got to like do it quick and double pump. This is not an everyday use pump, but it's a great accessory to have. It's also good to keep in your keep it into your like pump bag when you go back to work. You just put it in there as a backup. You never know when a pump can, crap out like our internet. It happens, or you have no electricity, or something happens where you need a manual pump. So we will be giving one away with our little package today, and I think having a manual is a great idea. The other thing about the manual pump from Evenflow, I don't know if you know this, but all of the Evenflow feeding pumps come with my breastfeeding class included, which then gets you inclusion into the private group. So if you want to get the pump, you'll get the class, which is simply breastfeeding. Another way to get it. So whoever wins tonight will also get the class as well. And we're going to give away one extra class. What I want you to do tonight for entry into the Evenflow feeding package, I want you to like this post or one of these posts of us coming on today. We did a few of them because the internet going out. You got to like the post, comment here, and then I want you to go over to Evenflow Feedings page and give them some love and tell them what you love about what I just showed you. Okay, give some love over on Evenflow Feeding because they're awesome over there, and I know they would love to hear from you. So go ahead and give them some love over on their Facebook wall. All right. Yay! Hearts for Evenflow, hearts for our pumping package tonight, and hearts for the fact that the internet is still working and we are all here together. Yay! Happy for the little things in life. Oh, fantastic. Okay, but we're not done. We're not done because we still have a few more questions, and I'm going to keep on going. And you guys have been asking me questions too. So let me just see. Let's see. All right. I'm going to answer somebody's question here. Okay. That's Andrea, who I just answered her question. Okay, Samantha. Samantha asked, I have a question. My son is 6.5 months and won't take baby food no matter what I try. Help. He's 20 pounds and suffering. LOL. Okay, Samantha, you do not need to feed your baby yet. There's no reason he has to take baby food. And in fact, if he doesn't want it, he's not ready. He's not ready. Right now, obviously, he's getting everything that he needs and more, 24 pounds at 6.5 months, from your breast milk if you are breastfeeding. I mean, you're not saying here whether you're breastfeeding or formula feeding, but I'd like to know the answer to that. But if it is that you're breastfeeding him and he's 24 pounds and not taking food, he obviously is not hungry. And that's obvious, okay, that he's probably not hungry. So, yeah, food, it's when we talk about starting solids with babies, we're talking about a minimum of 6 months. Like with a breastfed baby, you're waiting at least 6 months to even think about starting solid foods. But they don't have to start eating right away. You can wait, and a lot of people will say this, food before 1 just for fun. I actually think it's more than just fun. I think it's something that it's good to start when they start to show signs of readiness. It's healthy for them to start doing a little bit of both, but it does not have to happen at 6 months. It could be 7 months, it could be 8 months, it could be 9 months old. Your baby will show you their signs when they're ready. If he doesn't want it, he's obviously not ready. Interest in feeding, interest in eating is one of the signs. Being able to sit up is one of the signs. Being able to not thrust their tongue out where they're pushing, they have that maturity of the tongue where they can swallow and eat. That's something that you need to wait for all those things. And wanting the food is one of it. I would not worry at all. 6.5, he's exclusively breastfed. Well, you make ice cream for milk. So obviously your child is getting plenty of food and he doesn't need anything else. I would not worry. Keep offering it and then don't stress about it. Okay. You don't need any help. You're doing fantastic. There's nothing to help you with except congratulations. Good job, Mama. All right. Hearts for Samantha and her amazing accomplishment breastfeeding this little guy, big guy. Hearts for Samantha. Hearts for Samantha. Okay. I don't see hearts yet. Is there because it's a delay? Yes. I want to see hearts. I want to see hearts for Samantha. All right. Sierra, your supply is not doomed. Okay. Baby 7 weeks old, pumping and supplementing with formula. My period return this week. Is my supply doomed? Your supply is not doomed. It's very, lately I've seen more and more moms getting their periods earlier and earlier. You're not alone, okay? Getting your period. And if you start supplementing, it will keep encouraging your period to come earlier. So what I would say is that you're not doomed to not make enough. You will make enough. You like the ice cream? Yeah. Okay. Talking to Samantha there, not you. All right. So Sarah, the thing that you want to do is make sure that when you have a period, you are keeping up with your feeding sessions. You don't want to, decrease them at all. You want to keep doing them on demand and also more frequently. If your baby is not getting enough, meaning that if you're producing less, it could be that you just feed more frequently and that you'll still make enough. They just need to eat more frequently in order to get it. It will also help to boost up your supply overall. Sort of like what happened during a growth spurt. Okay, so make sure that you're feeding frequently, that you don't just keep increasing the formula more and more and more, because then you're going to create a secondary reason for your decrease in supply other than the hormonal effect of it. Okay, so yeah. Okay. Big loving hearts to Sierra. Hearts to Sierra. Okay. Where are we here? I think we're almost complete with questions here. Michelle said, I get anywhere from 4 to 5 ounces per pumping session. But my daycare provider says the little guy will take 5 to 6 ounces 3 times a day, which I feel like is a lot for him to eat. He's 4 months old. That's mommy saying that. I try to pump 3 times at work, but I'm in patient care, so some days I only get into a nurse on demand, ranges anywhere from 3 to 4 hours when I'm home. Is this okay? And I don't need to address it, or is there a way to get more out of my pumping sessions? To me, it feels like they're overfeeding your baby. To me, it feels like 4 to 5 ounces. What you're doing is more than enough milk to leave for 3 times a day. I feel like that 5 to 6 ounces, that extra amount that the baby is being fed, is probably because whoever's taking care of the baby is thinking that the baby needs to take an extra ounce, that the baby maybe is crying a little fussy, needs to be held, or maybe they're not burping enough. Something's happening here where they're overfeeding the baby. Try slowing down the feedings, okay? Try sitting the baby up for the feedings. Make sure they're not laying the baby flat down and pouring the bottle down. Make sure the baby's sitting in an upright position, more like, here's my baby. I'll take the baby and show you, okay? So, yes, Kate. Paced feedings. Yes, Kate. Okay, so sitting the baby upright, holding the bottle in a more of a horizontal position, okay, versus a vertical position, where just enough milk is filling the nipple, but it's not completely upright, okay? You want the bottle, and I don't have I do, I have, but no nipple on, okay? So the bottle is going to be held in a more horizontal position where it's just filling the nipple, but it's giving the baby the chance to slow down and pace themselves on the feeding, where they're controlling the feeding, where the milk is not just pouring down their throat, you will see that that will help to go slower, okay? Make sure that you're using a nipple that the baby can completely wrap their lips around. They're getting a good seal on that nipple, that you're not using a nipple that is pouring too fast, okay? Because all those things are going to cause the baby to overeat. And then the problem with that is it makes you feel like you're not making enough milk when you actually are. This is so common for moms who are pumping, leaving milk for their babies when they go to work, and then the childcare providers saying, you know, it's not enough, when it's most certainly enough. 4 to 5 ounces per feeding is most certainly enough for a breastfed baby. So I really don't think that it's more milk that you need to leave. I think it's more education for the person who's actually feeding your baby. And try doing it yourself. See if you can pace the feeding. See if you can supplement a pumped bottle when you're home with your baby, and do it slowly and see what the baby actually takes. Look for the signs of what the baby does when they're nursing at the breast, when they show that they're full. Or what do you do when the baby's full, not necessarily eating more at the breast, but needs some soothing? What is it that you do? Think of the things that your baby needs so that you can teach your childcare provider what to do with your child, okay? Thank you, Michelle. Good luck to that. Hearts for Michelle. Big hearts for Michelle and her amazing success. 4 to 5 ounce pumpings. You're doing great. This is the thing that makes me so sad, is to see moms who are doing so wonderful question themselves and think that there's something wrong when there's nothing wrong. It's just everyone around you not knowing what to do. And this is why it is so important for you to know what to do, for you guys to show up to our, weekly or bi-weekly chats like we're doing right now, to learn the basics, to take my classes, to learn wherever you can from each other, from me, from anyone else that you might follow and learn from, because that's how you're going to get the knowledge in order to know that you're actually doing quite well. Some people do have issues, but the majority of moms that I talk to, they're actually doing really well, and they're just doubting themselves, or they're getting bad advice. So yeah, hearts for Michelle. Hearts for Michelle. Okay. Now we're picking up here. All right, let's see. Jess is asking me, should I pump at night? Baby is 2 weeks old. I pump once a day to get my work supply up. Okay. Now, or are you doing it again? I know if you are back now, I'm not really sure what this question is. Maybe it's 2